Hi, this is Kristen, and I'm going to be talking about the open educational resource Human Anatomy and Physiology book, particularly the part that relates to the axial skeleton, chapter 7. And I'm going to continue talking about the remainder of the axial skeleton beyond the skull, so I'll be emphasizing the hyoid bone, the vertebra, and the ribcage. But before I move on to talk about those parts, I just wanted to reiterate the orbit of the eye is one part of the skull where 7 different bones converge. And I can't think of any other place where 7 bones come together. So I wanted to just point that out. So you can study this image. It's available online. It is from the Pearson textbook that we have in the lab. And the one bone that kind of stands out that's unusual is the palatine bone. And so I'm going to go ahead and highlight that. The palatine bone was the bone that basically made up the, well, part of the roof of the mouth, the bony palate, the bony hard palate. And so I wanted to point out that you have a little piece of the palatine bone called the orbital process of the palatine bone. And I'll go ahead and color this in blue. It's located right there. And it's just a small little process. The orbital process of the palatine bone is one of the 7 bones that can be found in the orbit of the eye. Okay, so enough said about that. Now I'd like to go ahead and continue moving on and talking about the axial skeleton. So first I'll talk about the hyoid bone. The hyoid bone is unique in that it does not articulate with any other bone in the body. So in other words, it doesn't form a joint with any other bone in the body. Its main purpose is that it provides a movable base for the tongue, and it is involved in swallowing and speech because it provides a place for neck muscles to attach. And I'll show you where they attach in just one moment. After I talk about the hyoid bone, I'll end up discussing the different aspects of the vertebra, the major regions, 5 major regions of the vertebra, the intervertebral discs, what makes them and what their function is, a couple homeostatic imbalances that relate to abnormal curvatures of the spine, the general structure of your typical vertebra, and then I'll point out some special vertebra with special characteristics that have a different form and a different function. And then we'll talk about the sacrum and the coccyx, which is the tailbone. And then finally, the sternum and the ribcage. So go ahead and move on to the next picture. This shows a hyoid bone. The hyoid bone is a horseshoe-shaped bone that is found in the neck. And like I said, it provides a movable base for the tongue. And then the neck muscles attach to what are called cornu. Actually, the greater horn, also known as the greater cornu, that's R and that's an N and this is a U, cornu, that is located right here. That is the greater cornu. And then also there are 2 greater cornus, the right and the left. So this would be the right greater cornu or greater horn, and this would be the left greater horn or greater cornu. I'll just put greater horn. Now the lesser horn is more anterior, and you can see that right there. And there's also one on the other side, the right and the left. It's the neck muscles that attach to these horns, and they assist with swallowing and speech. The body of the hyoid bone is basically the largest part, or the biggest main part of the bone. And so that would basically include this and this. That would be the body right here. Okay. All right, so let's talk about the vertebral column. The vertebral column has 5 major regions, and the first most superior region is the cervical region. The second region is the thoracic region. So the cervical region includes 7 cervical vertebrae, and the first 2 have special names. So C1 to C7. And then the thoracic curvature, which is just inferior to that, includes 12 thoracic vertebrae. And then the lumbar curvature, just inferior to the thoracic curvature, includes 5 lumbar vertebrae. And the sacral curvature includes 5 fused vertebrae, and the sacrum is located right here. And then the coccyx is the tailbone, and it includes anywhere from 3 to 5 vertebrae that are fused together. It depends on the person, but this little area here is the coccyx. And you have to be careful that when you're looking at the models, some sacrums have a coccyx attached and others don't. And sometimes the coccyx that's attached to it looks like it's part of the sacrum. So you want to make sure you look real closely at the models, because not all of them are the same. Some are better than others. So the cervical curvature, if you imagine that this would be the anterior side and this would be the posterior side when we're looking at a lateral view, the posterior portion of the cervical region is considered to be concave. So this would be concave. And I always think about, okay, the curve moves this way, and if you're standing here, you would be in the cave. And so if it was raining, the cave would keep you from getting wet. And convex is the opposite sort of curve that moves the opposite direction. And the concave curve, or the convex curve, would be like this. It would be a curve like this. And so it would be considered to be convex posteriorly. If you're looking at it from the posterior side, the curve would be like this. Concave would be like this. And then if we look at the lumbar curvature with L1 or L1 to L5, then once again we run into a concave posterior curve. If you're on the posterior side, it's concave. And then for the sacrum, and by the way, this is applying to the picture on the right that shows the lateral view of the vertebra. The sacrum would have a curve like this, which would be considered to be, once again, convex. Okay, so this is convex, and this is concave. So this is cervical, this is thoracic, this is lumbar, and then this is the sacral. Now, the coccyx technically doesn't have a curve, it's just part of the cervical curve right here. Okay, and what's the advantage of having these alternating curves in the vertebral column? Well, for one, the vertebra can kind of act like a spring. So with these alternating curves, it's better able to absorb compressive force. And it acts like a spring. These curves develop at different points in development after birth. So there's a mistake in this PowerPoint presentation. A primary curve which I'll write like this. A primary curve is one that develops first. It's the first curve in the vertebra to exist. So we're born with this, if you look at a baby, we're born with this natural curve that's convex posteriorly. So I will put the first primary curves in purple. This would be considered to be a primary curve right here. If you try to sit a newborn baby up, their spine has this sort of curve, the entire spine. The same curve can be found in the sacral region. And so they have a tendency to tip over forward. However, over time, as they begin to spend more time sitting up and learn to sit by themselves, they develop a secondary curve. And the secondary curve is this one. And it's called secondary because it develops second. So after some time, when the secondary curve develops, it's easier for the baby to balance and stay upright. So the mistake in this particular presentation is that this should say secondary, and this should say primary, and this should say secondary, and this should say primary, right here. So that's the correction I wanted to make. Okay. All right, so let's talk a little bit about the intervertebral discs, because they relate to these curves and that they help provide some, the spring-like shock absorption. There are two parts of an intervertebral disc. The very centermost part, which would be here, is called the nucleus pulposus. It's this area here in the very center. And the nucleus pulposus acts kind of like a rubber ball. It's a great shock absorber because the nucleus pulposus is made up of a gelatinous substance that makes it more elastic and compressible like a rubber ball. That's in the very center. So this is the center of the inner part. Now the outer part here is called the annulus fibrosus. And it's made up of collagen more superficially here, and it's made up of fibrocartilage more internally, closer to the nucleus pulposus. And the collagen fibers act like a collar, and they limit expansion of the center part, the nucleus pulposus, when the spine is compressed. The annulus fibrosus also binds the vertebra together, particularly the outer part, the annulus fibrosus. It helps the vertebral column withstand twisting forces, and it helps the vertebral column resist tension. So it stabilizes the spine as well as helping with shock absorption. All right. Sometimes when people undergo like a sudden twist or a sudden movement where they bend forward, what can happen is the intervertebral disc can be damaged such that the annulus fibrosus ends up pushing through, the nucleus pulposus flattens out and pushes through the annulus fibrosus, and that leads to a herniated disc, also known as a slip disc. And if you look at the image on the right, you can see where the circle is, that's an example of a herniated disc. And if that impinges on spinal nerves, that can lead to severe symptoms. Okay, moving back to this, I wanted to mention or bring up where the spinal nerves would be found. So if you stack one vertebra on top of another, so this would be the upper vertebra and this would be the lower vertebra, you can see that there is a space in here it's shown in green, there's a space between the vertebrae. I'm going to go ahead and color that in right here. Actually, I'm going to put my little circle on it. This would be the intervertebral foramen. The intervertebral foramen only exists if you stack one vertebra on top of another, and the spinal nerves exit from this point. Actually, every intervertebral foramen on the right and left sides has a spinal nerve. Okay, so now we're going to look at some homeostatic imbalances, in other words, disorders or diseases that are associated with the vertebral column. And these three pictures show three abnormal spinal curvatures. The one on the left, this is a lateral curve, and that is known as scoliosis. So you can see scoliosis here, and you can see how the spine has kind of a lateral curve to it, which is abnormal. In the middle, you see an example of kyphosis, and kyphosis is an exaggerated thoracic curve. And this would be like a hunchback. And so this is basically an exaggerated convex curve. You can see how this is convex on this side. Okay, and then the third type of curve here, this is called lordosis. And lordosis is an exaggerated lumbar curve. And this can happen if somebody develops a big belly or if somebody becomes pregnant. And both can lead to symptoms that are aggravating. Actually, all three conditions can. Okay. I did post a little quiz study guide for your upcoming class quiz, and I'm covering all the answers to those quiz questions in this presentation. And okay, so I'll go ahead and move on, and we'll look at the general structure of a vertebra. And I'm just going to use my eraser here on my Apple Pencil to make a circle and kind of point things out. Now the body, or the centrum of the vertebra, is right here, and this is what sandwiches the intervertebral discs. So we're looking at a superior view of a vertebra, a general vertebra, and each vertebra is stacked on top of one another at the body or the centrum, and in between each body or centrum you'll find that intervertebral disc. Now the vertebral arch is basically this area here, this whole area that attaches posteriorly to the centrum or body of the vertebra. So this is posterior and this is anterior in our superior view. So we'll say this is posterior and this is anterior. The lamina of a vertebra is this. This little area here is a lamina, and this is a lamina. And I always kind of think about, this being like a little house. So I've got, the walls of the house are here. The centrum makes up the floor. And then there's a roof on the house. And the roof actually would be a lamina. This would be one lamina, and this would be the other lamina, and together, if we wanted to say plural, we would say laminae. So there are two lamina. Now there are also pedicles. The walls of the house are called pedicles, and there's one on each side. And so the vertebral arch, which goes all the way around the vertebra, from here to here, that vertebral arch is made up of two pedicles and two laminae. And you might have heard of someone having a laminectomy. A laminectomy is where they basically remove one side, like they would take this out. That would be a laminectomy. Now, the danger in doing something like that is in the center of the vertebra, right here. This is the vertebral foramen. This is where the spinal cord is found. Now, a single vertebra has a vertebral foramen, but if you stack 2 or more vertebrae on top of one another, it's called a vertebral canal, because it's not just a hole anymore, it's a tube. Okay, I did cover the intervertebral foramina. There are these holes on the side when you stack 2 or more vertebrae on top of one another. And they're the holes through which the spinal nerves exit the spinal cord. Okay, we also have some processes that you probably noticed. There are 2 transverse processes, this being one and this being the other. So this is the right transverse process and this is the left transverse process. And there is a spinous process. The spinous process is found right here. And this is what you feel when you run your fingers down the center of your back. We call it the spine. So, just a quick recap here. Okay, the centrum is here. The vertebral foramen is here. When there are 2 or more vertebrae, it's a vertebral canal. This is the transverse process. This is a transverse process. Spinous process. Lamina, pedicle, and this is the vertebral arch. Now, there's also a superior articular process and an inferior articular process. So the lamina includes more than this process. This is a process with a facet here. It's sticking up, out toward us, because we're looking at a superior view. But the entire piece is the pedicle. So what this does is this superior articular process has a small oval smooth piece, kind of like a plate, called a facet. And the superior articular facet articulates or forms a joint with the inferior articular facet of the vertebra above it. And it's easier to see when we look at a different view. So I am going to go ahead and move to a different view. But these are the general bony markings of your typical vertebra. Okay, here's an example in this picture of how this would be the inferior articular process of the upper vertebra, and it's forming a joint with the superior articular process of the lower vertebra. And where they contact one another, each one has a facet, and that's that smooth plate right here. It's covered with cartilage. Okay, so let's talk about some special vertebrae that are unique because they don't look like any other vertebra in the vertebral column. One of them is called Atlas, and Atlas is C1, cervical vertebra 1, and it looks completely unique because it looks like a ring. It doesn't have an obvious spinous process. It is basically a ring-shaped vertebra. And the posterior part of this vertebra is right here. This is the posterior. Now, notice that the view on the right, this is an inferior view, so we're looking at it from below, and this is a superior view. We have facets here. Those are superior articular facets on top of, or that are a part of the superior articular process. Notice that there are foramina here. Those are those are a characteristic of cervical vertebra. They're called a transverse foramen. And then this is a transverse process right here, and there's one on both sides. Of course, this is the same vertebral foramen here, through which the spinal cord passes. And this C1 also has what is called an anterior tubercle. So that is the anterior tubercle, and this is the posterior tubercle right here. Okay. When you nod your head yes, the movement happens between the joint of C1 and the occipital bone of the skull. Specifically, the movement's occurring between the superior articular facets of atlas and the occipital condyles. And those things rock, your skull rocks forward and backward on those facets. Specifically the occipital condyles, which pretty much fit right into these facets. They have a similar shape, but it's convex fitting into concave. Now, another thing that's worth pointing out is that there is a facet right here, and that facet is where C1 forms a joint with C2. It's called the facet for the dens. Okay, so I'm going to have to tell you what the dens is, and that brings us to C2. Another name for C2 is axis. By the way, the reason that they called C1 Atlas is because of it's similar to the myth of Atlas, the strong man who held up the world, but in this analogy, the skull is the world. And so, and one other thing to note is that the atlas, being ring-shaped, has no vertebral body. There's no centrum. So that's really what makes it stand out and easy to identify as C1. Now C2 is called axis because it creates an axis of rotation. And if you're looking at the superior view on the left, you can see this tooth-like process. And in this picture, it's really jutting out toward you. It's sticking up. And so it's sticking up outward. And this fits into the facet for the dens so that the ring-like atlas can rotate around this dens. Dens refers to dental, so it's a tooth-like process. Also, you'll notice that the axis has a transverse process on the right and the left. It has a spinous process posteriorly, even though it's pretty subtle. It has a vertebral foramen. This is a lamina here, and this is a lamina here. This is the superior articular facet here. Superior articular facet. And the dens is the most important marking on axis because it really makes it identifiable as C2. There's no other vertebra that has this tooth-like process sticking up. So atlas sits right on top of dens. Now when you rotate your head, you rotate it to say no to somebody, you shake your head to say no, that movement occurs between atlas or C1 and C2. Specifically, the movement is occurring between the superior articular facet of axis and the inferior articular facet of atlas. Okay, now let's look a little bit at the cervical vertebrae. Here, you can see that there are 7 cervical vertebrae, and the cervical vertebrae have some unique characteristics that help you identify them as cervical rather than lumbar or thoracic, and that's something you might have to do on a lab exam. I might put out a vertebra and say, what type of vertebra is this? From what section of the vertebral column does this vertebra come? And so one thing you'll notice about the cervical vertebra is that they all have transverse foramen. They all have little holes like we saw here. All of them have this transverse foramen and the transverse process. So that's one thing that makes it stand out and makes it be identifiable. Also, it's supporting the least amount of weight of any of the vertebra in the column. It's supporting less weight than the thoracic and lumbar vertebra, so they're small vertebra. Also, the spinous process is bifid. What bifid means is that it's forked. Each spinous process is forked except for the 7th cervical vertebra. And of course, this can vary somewhat between people, but generally speaking, the 7th spinous process is the only one of the cervical vertebra that's not forked. C7 has a special name too. It's called vertebra prominens, and the reason is because it's a very prominent vertebra. You can palpate it, and as such, it can be a landmark. When you're counting vertebra, if you can easily feel that 7th one because it has a very prominent spinous process. Okay, so how do you identify a thoracic vertebra? Well, the thoracic vertebra are, if you look at a posterior view or even a lateral view, the thoracic vertebra look kind of like a giraffe head. Like this would be the ear, and this is an ear, and this is the giraffe nose. And what you can say about them is that the spinous process is usually pointed and angled downward in general. And they're a little bit bigger than cervical vertebra. They have no transverse foramen. They're smaller than lumbar vertebra. And their facets are oriented differently than lumbar vertebra. So here we see the superior facet of the lower vertebra forming a joint with the inferior facet of the upper vertebra. And you'll notice that these two facets are facing one another so that they each face anterior and posterior. The lower vertebra has a posteriorly facing superior facet, and the upper vertebra has an anterior facing superior facet. And as a result of that, it allows rotation. Thoracic vertebra can rotate the spine because they can slide past one another. Now, if we look at the lumbar vertebra, what makes them easy to identify is that they're usually bigger and chunkier. And if you look at this from the lateral side or from a posterior view, it kind of resembles a moose head. That if you notice, the spinous processes are shorter, they're chunkier, and they basically point straight backwards rather than down. They're not long spinous processes like the thoracic vertebra. They're short, chunky, and they point straight back. The thing that really gives it away, though, is if you look at the facets, the inferior facet, or the facet of the inferior articular process of the upper vertebra is oriented laterally, and the facet of the superior process of the lower vertebra is oriented medially. So instead of having anterior-posterior facets, it's got medial-lateral. And this prevents rotation. Lumbar vertebra can't rotate. They can flex and extend, but they can't rotate because the processes, the facets, lock one another into place. So we get rotation of the spine in the thoracic region, and we get flexion extension in the lumbar region. Also, another thing that you can notice about thoracic vertebra is the ribs attached to the thoracic vertebra in two places. And so the ribs limit the flexion and extension in the thoracic region somewhat. And then also, you can find additional little facets where ribs attach to the vertebra in that section. Okay, so when we look at this image, this shows the, looks like it's showing us a superior view of the cervical, thoracic, and lumbar vertebra. And here you can clearly see the things that really make it easy to identify these. The transverse foramen, that's how you identify a cervical vertebra. The lumbar vertebra, you'll notice it has kind of an oblong-shaped vertebral foramen, whereas the thoracic vertebra has a very round vertebral foramen. Okay. As we move on, this is showing you a lateral view of the vertebra, and you can notice the thoracic vertebra. This looks like a giraffe head, and the lumbar vertebra looks like a moose head to me. The thoracic vertebra has spinous processes that are long and pointed down. Lumbar vertebra are going to be the largest, chunkiest vertebra because they support the most weight, and the spinous processes are shorter and point backward. Now let's look at the sacrum. The sacrum is part of the axial skeleton, and it makes up this piece of bone that kind of looks like a shovel. And it's part of the pelvic girdle, but the lateral bones, the coxal bones of the pelvic girdle, are part of the appendicular skeleton, and this sacrum is part of the axial skeleton because it's along the long axis of the body. Typically, the sacrum is made up of 5 fused vertebrae, but it can vary from one person to another. So they say, approximately 5 for most people. When you're looking at the sacrum, this shows the anterior view here, and this is the posterior view. And you'll notice that the anterior view is has a much smoother surface anteriorly than it does posteriorly. Okay, so the sacrum has the anterior superior most part of the sacrum is called the sacral promontory, which is right here. This is the sacral promontory. And the transverse ridges are these horizontal ridges that run right to left between these holes. Those are the transverse ridges, which is shown here. Now, the anterior sacral foramina are all of these holes. Foramina means holes, and so these are the left anterior sacral foramina, and these are the right anterior sacral foramina. And the coccyx is shown right here. This is the coccyx. So really, the sacrum ends here, starts here, and ends here. Now, the sacrum has superior articular processes right here and here. And this anterior side pretty much covered everything on the anterior side. Let's look at the posterior side here. Now, on the posterior side, you get a much better view of the facets on the superior articular processes, and those articulate with the inferior articular process of lumbar vertebra 5, or L5. And the joint between L5 and S1 is a very common place for people to injure their backs. The auricular surface. Auricular surface means, auricular refers to an auricle, which is ear, and the auricular surface is ear-shaped. So it's a really rough area that's ear-shaped on the right and left sides. Here's the right side. Actually, this is the left side. This is the right. And you're also going to find an auricular surface on the coxal bones when we study the appendicular skeleton. And this is the place where the sacrum forms a joint with the coxal bones to form the pelvis. And the posterior sacral foramina can be seen on the posterior side here, this much rougher side. And the median sacral crest runs along the midline from superior to posterior. This is the median sacral crest along the midline, this vertical crest, this raised area. And the sacral canal is a canal through this bone. It basically the canal runs between the transverse foramen from superior to inferior, and right behind, or actually it would be right anterior to this median sacral crest. Now this little opening right here, this is called the sacral hiatus. And the spinal cord stops at approximately L1 or L2, but there is a bundle of nerves that continues down through the vertebral canal and through the sacrum. So this is the sacral hiatus right here. And then this is the coccyx. All right. Hiatus means gap, basically. And so that's what this is, that little gap where nerves can exit. Okay, I think I've covered everything there. The last thing I wanted to mention was the rib cage. Now the rib cage is actually composed of ribs, hyaline cartilage called costal cartilage, and the sternum. Costal means rib, so the costal cartilages are basically attaching the ribs to the sternum. Now the sternum is formed through 3 fused bones. This top bone right here, it's kind of shaped like a stop sign a little bit. This is called the manubrium. That's the manubrium. The second major bone is the sternum. This is the sternum right here. That's actually called the body of the sternum. It's the main part of the sternum. And then the xiphoid process is this little piece right here that hangs inferior along the midline, hangs down from the sternum. These 3 bones basically make up the sternum: manubrium, body, and xiphoid process. Now the xiphoid process, actually all of these landmarks are written right here. Now there are some notches that are worth mentioning. This little notch right here, this is a very subtle notch. It's called the jugular notch of the manubrium. And this little notch here, these 2 notches, I'm exaggerating them. Each of those are called the clavicular notches. So each one of these would be a clavicular notch. Clavicular notch, or CN. And this is a clavicular notch. Okay, now where the manubrium meets the body of the sternum, this little joint here, well, it's not a joint because the bones fuse, but this little point where these 2 bones fuse together is called the sternal angle. And this is something that you can palpate. You can feel your sternum, and it's a little angle or a little bump. And it is a good landmark to use when placing electrodes for an EKG. Sternal angle. And then this, as I said, is the xiphoid process. Okay, so there are 12 pairs of ribs. So males and females have the same number of ribs. 12 pairs there are 12 on the right and 12 on the left. This is your first rib, second, third, fourth, fifth, sixth, and seventh. And I think the book that we're using online has a slightly different picture in that it shows, for example, in this picture we have ribs 8, 9. Why is it doing that? Hold on. I don't like that. Hold on. Just a second. Okay, so this would be 8, and this is 9. This is 8. Eight, 9, and 10. And I seem to not be able to write. Sometimes I can write and sometimes I can't. I haven't quite figured out what the problem is. 8, 9, and 10 here. And And then we have ribs 11 and 12. 11 and 12 in this image are shown as floating ribs, meaning they're not actually attaching by cartilage to the sternum. In your book, I think they're only showing rib 12 as a floating rib. It doesn't really matter. The main point is that you understand how they're named. So ribs 1 through 7 are considered to be vertebral sternal ribs. And the reason they're called vertebral sternal is because each rib attaches to the sternum using its own piece of cartilage. So for example, this cartilage belongs to rib 1, this cartilage belongs to rib 2, and so forth. Notice that the first 7 ribs have their own cartilage and they attach directly to the sternum. So they're called vertebral sternal ribs, because each rib is going to attach to the vertebra in the back, and then it's going to wrap around the body and attach to the sternum through its own cartilage. So that's why it's called vertebral sternal. Sometimes people call them true ribs. I really don't care for that term. I like vertebral sternal because it's more descriptive. Now, ribs 8, 9, and 10, what makes them a little bit different is that they don't attach to the sternum with their own cartilage. This is the cartilage of rib 8, and this is the cartilage of rib 9, and this is the cartilage of rib 10. But what they do is they attach to the cartilage of rib 7. And another name for cartilage is chondrule. Chondrule means cartilage. So these start off attaching to the vertebra posteriorly, and then they wrap around and they attach to the cartilage of rib 7. And so vertebral chondrule. Chondrule refers to the cartilage here. So this is vertebral chondrule, where chondrule is the cartilage of rib 6. Oh, excuse me, rib 7. Cartilage of rib 7. That's what chondrule means. And then any rib that doesn't attach to cartilage, any rib that's floating, is going to be called a vertebral rib, because it's only articulating with the vertebra and it's not articulating with cartilage or the sternum anteriorly. So most often we see this. We see ribs 11 and 12 is vertebral, 8 through 10 is vertebral chondrule, and ribs 1 through 7 is vertebral sternal. Okay, if we move on, I just wanted to mention I just wanted to talk real quickly about the parts of a rib. And if you study the bones, you'll see that typically ribs are attaching to the vertebra, and it's more superior where they attach to the vertebra, and then they wrap around and they dive down and forward. So notice that the anterior part of the rib up here is actually more inferior. It's lower than the attachment to the vertebra. Also notice that the rib attaches to the vertebra in 2 places. The head of the rib, where I'm putting this H, attaches to the vertebral body, right there. But then there's a tubercle of the rib, which is located here, that actually attaches to the transverse process of the vertebra right here. And you can see that over here. This is the head of the rib. This is the tubercle of the rib. The head attaches to the body of the vertebra. The tubercle attaches to the transverse process of the vertebra. And the area between the head and the neck of the rib, this region is called, the area between the head and the tubercle of the rib is called the neck. So this is the neck of the rib. If you look at the rib here, you can see that this is called the costal groove. It's a groove that runs along the inner inferior portion of the rib, and it holds a nerve and blood vessels. Here we have the head, the neck, and the tubercle. And the head has facets, those little smooth oval shaped pieces that basically form a joint with another bone. And also the tubercle has little facets. They're little smooth oval shaped pieces. And so you'll be able to identify the facets when you're studying the bones. And then of course the longest part of the rib is called the shaft, and the angle is the tightest curve. That would be the angle of the rib. And this is the costal groove. It's real obvious right here. Okay. If you turn a rib and look at the profile, like you can see right here, the costal groove is basically right here. It runs along the shaft, and that's where that nerve and blood vessels fit. So that's it for the axial skeleton. And if the screen went blank when I was talking and I didn't notice it, please feel free to ask me some questions in lab or in class. We're going to be moving on to the appendicular skeleton next, and so that will be the limbs of the shoulder, the limb bones, shoulder girdle, and pelvic girdle. So I'm going to go ahead and stop here.